Hello and welcome to this introduction video for the online group sessions created by the Cardinia Health Pelvic Pain and Endometriosis Clinic. This video is designed to give some background for the various sessions available and help you decide which may be most useful for you. First, we would like to acknowledge that this presentation was created and recorded on Wadawurrung country, and we pay our respects to elders past and present. We also pay tribute to and take inspiration from the crucial role that Indigenous women play in nurturing and healing. We would like to also acknowledge that although our clinic is funded to provide services to people assigned female at birth, we know that not everyone with endometriosis or pelvic pain will identify as female. These presentations may contain gendered themes or language, but we will aim to use neutral anatomical terms wherever possible. We also want to be open that endometriosis and pelvic pain have long been under-researched. Luckily, the tide is changing, but we still have lots to learn. And finally, these sessions are general in nature and do not replace individualised medical assessment and advice. So, what is persistent pelvic pain? Well, it's complex, and it's likely that if you have found your way to our clinic that you have been experiencing pelvic pain and associated symptoms for a long time. And it's almost certain there will be more than one factor contributing to your symptoms. What pelvic pain means to you may be different to someone else and incorporates many different types of pain. The pelvis is the area below the belly button, down between your hips, and if you look at this side-on view, you can see it's where your bladder, uterus, ovaries and bowel all sit, as well as muscles and joints like your pelvic floor and hips. So there are lots of potential triggers for and contributors to pain. Whatever these may be, if you have pain in the pelvis on most days of the week for more than 6 months, we say you have persistent pelvic pain. It's really important to know that persistent pelvic pain is a diagnosis in itself. Think of it like a big umbrella under which lots of other medical conditions can sit. Some of these conditions may be familiar to you, such as endometriosis or IBS, but it's important to note that you don't need to have any of these specific conditions to be diagnosed with persistent pelvic pain or to have your pain managed. It is of course important that you have individual assessment to consider these conditions, but it's also so important to understand that if your team can't find a clear biological cause that explains all of your pain and symptoms, it doesn't make your pain any less real and is even more of a reason to think about your symptoms more holistically. Even for those of you who have been diagnosed with endometriosis, it's important we still consider your whole body, as so often there are other pieces to the pain puzzle. This diagram from gynaecologist Dr. Peter Wright is a nice explanation of how other factors can sit under the surface in pelvic pain. And if we focus solely on surgical diagnosis and management of endo, we miss out on so many other opportunities for support and healing. Maybe you've been diagnosed with endo and you've found that your pain is ongoing, even though you've had surgery or are taking medications to stop your period. Maybe some of you have had surgery and didn't find any endometriosis at all. Maybe over time you've noticed new symptoms creeping in, like bowel changes, pain with sex, fatigue, or pain in other parts of your body. That is why these sessions have been designed to focus on pain and associated symptoms rather than solely endometriosis. By the end of these sessions, we want you to feel empowered to understand all the factors that might play a role in your symptoms to help improve your quality of life. To best do this alongside our group sessions, we recommend a multidisciplinary approach, which means using various healthcare providers, ideally who are interested and skilled in pelvic pain. We also recommend using a biopsychosocial approach, which means not just looking at those biological factors, like those we saw under the umbrella a few slides ago, but also the psychological and social factors that can influence pain. We also recommend that your approach is individualised to you and your priorities. So again, it's important you have a thorough assessment by qualified and experienced practitioners for personalised advice. So here we have the list of topics available to join online. We encourage you to attend as many as you feel you can. There will be new dates announced every few months if a particular time doesn't work for you. These sessions do not need to be attended in order, aside from Why It's Not All in Your Head sessions 1 and 2, which are best attended in sequence. You also may find the introduction session a helpful place to start and the wrapping up session a good finish. So, to help figure out which sessions may be most useful to you, let's consider what factors can contribute to persistent pelvic pain. There are lots of things, which can feel overwhelming, but it also means there are lots of ways to approach your pain management. If we look first at pre-existing or predisposing factors, we know there are certain factors that can increase your risk of persistent pelvic pain, such as genetics and hormonal and immune system factors. We won't dwell on these too much, as many of these will be out of your control, but it can still be helpful to explore with your care team, and just to flag that there is a lot of research underway to better understand how these factors can lead to increased pain. Then if we think about what's happening locally inside the pelvis, so remember you have your bladder, uterus, tubes, ovaries, bowel, as well as blood vessels and nerves all within a small space. And we commonly see multiple organs becoming involved in your symptoms. So we need to keep them all happy. Because of the way nerves connect to the organs in our pelvis, it can sometimes be hard for our brain to identify what organ or area is irritated. This concept is explored further in our session, A Headache in the Pelvis, which we encourage you to attend. If we look even more specifically at gynecological contributors, this might be relevant to you if you have been diagnosed with endometriosis, adenomyosis, if you have painful periods, pain with ovulation, or external pain, sometimes called vulvodynia, or if you notice symptoms linked with your hormonal cycle. If this is the case, we encourage you to attend our session explaining periods, hormones and medications, and also our session on pain and sex. And you can also watch our pre-recorded video on endometriosis with local gynecologist Dr. Edwina Coughlin. Then if we think about the bladder, maybe you have a history of recurrent infections or have been diagnosed with painful bladder syndrome or interstitial cystitis. Or maybe you've noticed issues with how you empty your bladder. If this is the case, we recommend you attend our sessions, Headache in the Pelvis, and Bladder and Bowel Care. Maybe you feel your symptoms are more linked in with your bowel. You may have been diagnosed with irritable bowel syndrome or experience constipation, bloating, or get pain with opening your bowels. If this is the case, again, we recommend attending our session on bladder and bowel care and also nutritions for tools to help optimise your bowel function. Then it's really important we consider the involvement of surrounding muscles, joints and ligaments, especially the pelvic floor. You can see here the pelvic floor is a collection of muscles that lie in a sling under the pelvic organs. And so it's common for them to tense up in response to triggers in the pelvis, or even in response to fear or external dangers. The majority of people with persistent pelvic pain are found to have at least some degree of pelvic floor involvement in their pain and symptoms. You may notice symptoms such as pain with sex or internal examination, or have been diagnosed with vaginismus, a term used to describe involuntary muscle spasm around your vagina. Maybe you've had incontinence or troubles with opening your bladder or bowel, or possibly sudden sharp pains in the bottom or vagina, or even pain through the sides that can feel like ovary pain. These symptoms can all be related to your pelvic floor. So if you haven't had an assessment by a physio with additional training in pelvic health, we strongly recommend you do so, alongside attending our physio-led sessions as highlighted here. Then we need to consider the pain pathways and the brain. Pain, by definition, is an unpleasant sensory and emotional experience, as interpreted by the brain in response to danger, whether that is something happening inside your body or an external danger. We want to make it very clear that we are not saying your brain is making up pain, but there are things that can make that pain message louder, like stress, fear, or lack of sleep. We need to tackle pain from all angles, so not just at the pelvis level, but also address how the message is transmitted via nerves from the pelvis up the spine to the brain and how the brain responds. For many people with persistent pain, we can see changes to the nervous system over time. You might have heard this referred to as central sensitization or pain system hypersensitivity. We know this terminology can make it sound like you are overly sensitive, but what it's trying to express is that your nervous system pathways are more easily activated or switched on. The brain's default has become pain because this is the message it has had over and over again. Maybe you've noticed pain now occurs on more days of the month, or with less of a trigger, or no obvious trigger at all. Maybe you've developed more general symptoms like fatigue, brain fog, or have been diagnosed with other chronic pain conditions like fibromyalgia or chronic migraines. Understanding how your nervous system works is really important, and understanding all the factors that can turn up or turn down the dial on your pain experience can be really empowering to help you take back control. All of our sessions address these concepts to some degree, but we especially recommend attending our toolbox and goal setting sessions and our pain psychology sessions, Why It's Not All in Your Head. We also cover some of the medications used for this element of pain in our medications session. And finally, we need to address the consequences of pain on your quality of life, because we know that persistent pelvic pain can lead to poor sleep, decreased movement, altered eating behaviours, mood changes, withdrawing from friends and family, impacting personal relationships and intimacy, and even impairing immune function, all of which can increase pain further. These issues are addressed to some degree across all of our presentations, where you will hopefully find some tips and tools to help improve your quality of life. Thank you for watching this introduction presentation. As you can see, it can be a big and complex picture. We encourage you to take the time, talk to your healthcare providers and supporters about which factors may be important to you and what you have capacity to focus on at this time. We welcome your feedback on sessions and any future topics you would like us to deliver.